Depression is the largest cause of disability across the world and can affect anyone. But many times, people consider this a taboo and don't want to talk about it. That's why we are.
More often than not, the early signs of depression get missed, and this leads to delayed diagnosis and treatment. This sometimes can even lead to suicide.
Now, multiple factors play a role in making someone prone to depression, and that is why it is important for us to know and recognize these symptoms.
So today, let's see on how we can recognize depression and what treatment options are there to help people who suffer from it. I am Dr. Sonia Lal Gupta.
And I am Dr. Sameer Gupta, and welcome to Doctors on Call. Depression affects more than 5 crore people just in India. Some common symptoms of depression are prolonged sadness, a weeping tendency, low confidence and self-esteem, lack of interest in work, a feeling of hopelessness and helplessness, feelings of guilt, suicidal thoughts.
We spoke to Dr. Rajesh Sagar, Professor of Psychiatry at AIIMS, who told us about the different treatment options for patients with depression.
Sometimes what happens that people, they use loosely the term depression, and as a lay person, when they say I am depressed, may not mean clinical depression, because as a psychiatrist, as a medical term, what we use is a depressive disorder or clinical depression. When we talk of clinical depression or depressive disorder, there should be dysfunction. It should affect a person. There should be distress associated with it. There has to be a disability associated with it. What it means is that you are not going to office, you don't want to meet people, and if a young student is there, he doesn't want to go to school or college and so on. So this is important. So it's not just a symptoms, but also it has to be persistent, pervasive, dysfunction. Then this is called as a clinical depression or depressive disorder. A lot of people have a misconception that depression, that you will get over it over a period of time, and we can take a person for holiday, he will be fine. If I take alcohol, smoking, I will get over it, which is a misconception or myth about it. If it is a clinical condition, if it is of moderate intensity or severe, then the medicines are required, and these medicines are evidence-based, tested all over the world, which are quite effective. By and large, if there is an episode of depression, then we may give a treatment up to 6 months, that is the time period. If there are multiple stress factors, if the let's say the social environment is not conducive, if there are other risk factors, so it may be given for longer period also. With this new mental health care bill, now the act which has come up, so what is decriminalization? So it will be assumed the person who has attempted a suicide is actually under severe stress unless proved otherwise. It will be assumed that is a person in severe stress, so he will not be taken up for the section 309. So what it means is that person who has survived a suicide attempt, we understand that that person will be under stress or may have some psychiatric illness, will have a depression. So instead of just taking up for a prosecution, he can be taken up for a treatment and providing a support, because that's important, because they require a help from all of us. I think that becomes a very crucial and key. So I think that it should be beneficial to a person, to the family and society as a large.
Mr. Naveen Kumar from Manas Foundation mentioned the importance of counseling. He also highlighted how NGOs like the Manas Foundation help bring awareness and provide support with full confidentiality.
A medication cannot affect the thought process. That is where therapy and counseling comes. It is the process through which your cognitive framework or your thought process can be influenced and then changed. In case of mental health problems, the problem is not that we are not capable of seeking help. The problem is we don't know the language. So for mental health, our society or community does not have a language कि इसको, how do I say it? How do I tell you? मेरा दिमाग खराब हो गया है, मैं फैसले नहीं ले पाता हूँ, मैं कुछ सोच नहीं सकता हूँ. Now see, this is what you say. If your leg is broken, you can go and say मेरे पैर में दर्द हो रहा है, मेरे दांत में दर्द हो रहा है. That language exists. What do you say if I don't feel like getting up in the morning? So we don't have that language. So the basic problem is, first we have to develop a language or a medium through which every individual can communicate his mental state. So seeking help will come. We as a society don't have that language to address mental health problems.
Remember, you are not alone and depression can be treated. In fact, the first step WHO aims to address are issues around discrimination and stigma associated with mental illness.
And as members of the community, we have to get together in spreading awareness and providing support. That's all for now. See you next week.